Hi everyone, welcome to my YouTube channel. So in today's tutorial we shall be doing IV cannulation technique. So in this video we shall be discussing how to do IV cannulation technique. So before you start the procedure, you're supposed to introduce yourself to the patient and clarify the patient's identity. Explain the procedure to the patient and gain informed consent to continue. So inform the patient that the cannula causes some discomfort, but it will be short-lived. So before you start the procedure, ensure that you gather all the following equipment for you to perform the procedure. First, you will need a blaster, adhesive blaster, or we can call it strapping. You will need a strapping. So you will need a gloves, disposable gloves to use as a tourniquet. So we shall be using this gloves as a tourniquet. So we will need sterile water for injection for us to flush the cannula. So you will need a cotton wool for you to rub the skin or to apply pressure where you have given the shot. So we shall need alcohol swabs for us to clean the skin. So we shall need a syringe and 21 gauge needle for us to flush the cannula. So you will need a cannula, a blue cannula, that is 22 gauge cannula for us to do the procedure. So we shall need methylated spirit for us to clean the skin. So first you need to inspect the veins and ensure that the patient's hand is comfortable. So you ensure you recheck the vein for you to do the procedure. So first you remove the cannula from its manufacturer's packaging. You remove the cannula, so you attach the wings like this. So let us proceed now. Let us do the procedure. So you remove the cap of the cannula first. You remove the cap of the cannula and you remove the cap from the end. Then you apply a tourniquet. You apply a tourniquet first. Then you inspect the vein. Then you apply alcohol swabs to clean the vein. You apply an alcohol swabs to the vein, so you can see the vein is very visible. Then you hold the cannula like this. That degree angle to the vein. So first you insert that degree angle. After you insert, when you see a flashback, you pull back the needle. Then you advance the cannula and you remove then the tourniquet so that you can proceed. So let us do now. The first step is you insert the cannula that degree angle to the vein. I hope you can see there's a flashback. So after you see a flashback, you pull back the needle slowly. So you can see here the cannula is very secure. Then after that you advance the cannula deep into the vein like that. Then after that you remove the tourniquet. Then you remove the needle from the cannula. Then you apply your thumb here. You apply pressure on the tip of the vein. Then you remove the needle and you attach the cap like that. So you remove the needle slowly like that to avoid blood rushing outside the body. So you do like that. So I hope you can see the cannula is now well secured. Then you get a strapping or adhesive plaster. So you apply a strapping like this. So this is how you are going to secure the cannula. You rest well. Then you get sterile water for injection for you to flush the cannula. You remove the syringe from the manufacturer's packaging. You get a 21 gauge needle. You attach the syringe and you withdraw sterile water for injection for you to flush the cannula. You remove the cap of the needle and you put its cap like that. Then you hold your thumb here for not blood to come outside, so that blood will not come outside. So you apply a pressure here. You remove the cap of the cannula. So this is how you are going to flush the cannula. I hope you can see the cannula is well secure. Then you apply pressure here. You apply pressure here to avoid blood rushing outside the cannula. So you apply your thumb here. You apply a pressure. So this is how you are going to secure the cannula. So after you complete the procedure, you thank the patient for the procedure. Then you remove the gloves. Then you wash your hand. After the procedure, make sure you wash your hand. Then you thank the patient for accepting the performing of the procedure. Thanks for your watching. Have a nice day.